So this is my view just of my POV of my brochure that I decided to do. So essentially what I got is just, it's a medication management brochure essentially. And so I started off with just the heading. Headings are really important with mental health patients, helps them organize info a little better and kind of gives them a better understanding as to what they will be doing with their medication. So I made sure all my borders or my subheadings and headings were capitalized or in text that they could read and identify and understand what I'm trying to get across here. So I just said managing bipolar 1, medication management made easy. So just simple steps as to what your medication is about, how to take it, what side effects you need to look out for, signs of toxicity, suicide ideation side effects, things of that nature. So when we hop into it, I'm just going to get out of that view so you can kind of see it a little bit closer. But we get into managing bipolar 1 right here, and we go into clonazepam. So we see that clonazepam is the general name and Klonopin is the brand name. So I say the use right here is just to treat manic symptoms and panic attacks and bipolar. That's what it was used for my patient. It has a whole nother list of uses. It's a sedative drug, so it's used for a variety of things. And I said, what is mania? And I just explained mania to kind of give them an understanding as to what it is. You know, sometimes these patients don't even know what they're thinking at some point. So I just asked the question, kind of, what is mania? And I said, periods of extreme changes of mood consisting of hyperactivity and unreasonable euphoria. And in parentheses, I just said intense excitement. Kind of that risk-taking behavior, like going out, spending a bunch of money on something you can't afford, things like that. And then I have the class over here, which is just benzodiazepines, and I just said the mechanism of action for this drug was to stimulate inhibitory GABA receptors in the central nervous system and exhibit a calming effect. That was the most simple way I could explain the drug. It has various neurotransmitters that it acts on. GABA is just the main one, and we learn in psych that it produces a calming effect. So I just did that in quotes and kind of thought that would be the easiest way for the patient to interpret the action of the drug. So if we go into side effects, it's a long list, as they normally are for medications. We see that in the commercials all the time. There's like 20 side effects that come up. For the first one, I just said suicidal thoughts because the first thing I'm thinking is just safety with this medication for this patient. So I said suicidal thoughts, contact primary physician if these occur. And then I said kind of more sedative side effects like drowsiness, fatigue, slurred speech, behavioral changes, and then kind of the neurological effects like ataxia, which is poor muscle control, often resulting in clumsy voluntary movements. And then I had what this drug should be used cautious in. So I said use cautiously in hepatic impairment. In quotations, I said the liver, just so they understand what that is. Pregnancy, acute narrow angle glaucoma, and seizure history. And meds to avoid, I said antihistamines like Benadryl, narcotics, morphine, oxycodone, hydrocodone, antipsychotics, muscle relaxants, CNS depressants like alcohol, anything that's really going to cause respiratory depression, which can lead to coma and death. So they need to know that they need to avoid those meds. Then I have education. I said Klonopin causes sedation. Do not operate vehicles/motorized vehicles. That is just because it's safety again, going back to safety. If, they fall asleep or, they're sedated, they're not going to obviously have 100% sobriety necessarily. So should not be operating vehicles when they take this. Avoid alcohol. That's the CNS depressant, could cause respiratory depression. I said take as prescribed, take with food at bedtime. take with food just to avoid some of that gastric distress, and at bedtime because of its sedative properties. So it will kind of help with falling asleep. And then I go on to medication review. I say, we know that this medication has a lot of interactions. So I think the first thing that I'm thinking when I want to talk to my patient is I'm going to want to know what medications they're on. I'm going to want to know their over-the-counter medications. I'm going to want to know prescribed meds. I'm going to want to know herbals. I'm going to want to know vitamins, supplements, all things of that nature. And this is just essentially to let the patient know that it has a lot of interactions and it can interfere with the effect of the drug and lead to serious precaution or serious measures. And I just told them to notify their primary physician or pharmacist of all their current medications they're taking before they are on Clonazepam. And then other important info, I just said symptoms of overdose. So I just said it can include drowsiness, confusion, coma, which is loss of consciousness for a short period of time. And then I said in case of an overdose, I kind of gave them like a helpline number that they can call and get more information about on that if they have more questions. And then on the end, I just had a inspirational quote, and it says, "The road to recovery will not always be easy, but I will take it one day at a time, focusing on the moments I've dreamed about for so long." So it's just kind of giving them that positive reinforcement, letting them kind of know that anything's possible and there's going to be road bumps along the way to recovery. But, through the power of work and adherence to the treatment plan, essentially, this is just giving them that hope that they can be cured once again and go back to society and normal functioning. So that is my brochure. It is kind of short. I tried to include everything that was in the email. But yeah, hope you guys enjoyed the presentation. So, peace.